Hello, I'm Dr. Fahim Khan. I'm the rheumatologist in the Autoimmune Hospital, Kilkenny, and I just want to give you a quick talk on the recent COVID-19 clinical guidelines for adult patients with rheumatic diseases, which were developed by the ACR COVID-19 clinical guidance task force. And they were actually fairly new. They were approved by their ACR board of directors on the April 11, 2020, and recently published just almost a week ago on April 29th, 2020. So the purpose of basically these guidelines is to provide guidance to rheumatology providers on the management of adult rheumatic disease patients in the context of the COVID-19 pandemic. So basically, what I see as a rheumatologist, patients who have rheumatic conditions, we have, as you know, patients who are on drugs like disease-modifying anti-rheumatic drug therapy. And as you know, some of these medications have potential for increased risk of infection, and perhaps some of them have risk for immunosuppression. Some of the patients are on biologics therapy. So this talk is mostly for our general practitioner colleagues, primary care physician colleagues, rheumatology colleagues, to just update them and inform them about the rheumatology care and services available during the COVID-19 pandemic, and what we are doing at the moment. So basically, in my rheumatology clinic, I'm still seeing patients who have rheumatologic conditions, because the most important thing is to make sure their underlying inflammatory arthritis is well controlled. So as you know, that if a patient with active rheumatoid arthritis and their disease is quite active, there's increased risk of infection is there. And in the pandemic situation of the coronavirus COVID-19, unfortunately, patients are at high risk of infections. And therefore, as a rheumatologist, I want to make sure I see them, I assess their disease activity scores, make sure their disease is well controlled, thus minimizing the risk of infection. And we take all these measures as regards to, to help our patients to minimize the risk of infection. So the drugs, I thought I'll just quickly summarize the medication that we are all using in rheumatology practice, starting from the corticosteroids, which, as you know, increase the risk of infection, to disease-modifying anti-rheumatic drug therapy like methotrexate, a drug which truly it is, you could say, immunomodulatory agent rather than a truly immunosuppressive. So we have patients on methotrexate. Some of the patients are on medication like lefunomide, which is a disease-modifying anti-rheumatic drug therapy. Sulfasalazine is also being used for patients with rheumatoid arthritis and many other rheumatologic conditions. Then we have the biologics therapy, which are immunosuppressive medication, and they suppress the immunity in patients. And then we have purely immunosuppressant drugs like the cyclosporine, azathioprine, etc. So I thought it's best to just give you a quick update as regards to what the guidelines are saying. So if you look at the guidelines, basically the general statement of patient with rheumatic disease, which we all know is the risk of poor outcome from COVID-19, appears to be related to primarily to general risk factors such as the age and comorbidity. We all know about that. So therefore, patients should be consulted on general preventive measures, which we are all doing it, like social distancing, hand hygiene, etc. So basically, patients who are on their medications, we don't need to make any changes to them unless they're exposed to the virus. So patients who attend me in my rheumatology clinic, patient, let's say, with rheumatoid arthritis, I just want to make sure their disease is well controlled. So if they have had any lab work, blood tests are fine. Otherwise, patient depends from patient to patient. Patients who are not at high risk of developing problems, they are at this stage discouraged to go more frequently for their blood test because of the risk of infection. So there are other methods of assessing their disease activity scores by clinical methods. We also use ultrasound to look at their joints, looking for underlying active signs of arthritis like synovitis. So there are many other ways of assessing their disease activity scores apart from inflammatory markers. And once they are assessed in the clinic, their dose of medication is adjusted. If they're higher disease activity, we adjust the dose of either methotrexate, biologics therapy. So we treat them as per normal. However, patients who are on, let's say, there's a need or room for the steroids that we can reduce the dose, we try to cut down on the dose of steroid, aiming to use perhaps a lower dose of the corticosteroids. So that's very important, and we try our best, if indicated, low dose glucocorticoids, less than 10 milligrams of prednisolone equivalent would be perhaps much more safer if we can use and try that dose for a patient. So we are doing all what we can, aiming to minimize the risk of infection for the patients. These are measures which I'm taking in my clinic when I see them. We try our best to see them. I would see my patients as soon as possible, whether it is acute inflammatory arthritis, even in the COVID-19 pandemic. We are working hard to, at the same time, to see our patients, plus also to minimize the risk of their infection. So they are put on the treatment as per normal. We would do it in normal everyday rheumatology practice. This is what I do in my clinic. I would assess them, want to make sure the disease is well controlled, give them advice about the COVID-19 prevention, adjusting their medication if required. Also, to boost their immune system, zinc, around 50 milligrams, roughly the dose is 50 milligrams per day. Vitamin C, 1000 milligrams per day. Vitamin D is also given to patients because it all helps the immune system. So this is something like to boost your immune system. Vitamin D at the dose of 1000 international units per day. Then we have selenium, which can be given to from 200 micrograms up dose. Turmeric, and all these sort of, this is a general advice to patients, that is to help the immune system to work very well. So in the context of the COVID-19 exposure, what do we have to do? And that's the most important question for everyone. So patients who are on, let's say, hydroxychloroquine therapy, we don't recommend stopping them, and patients, they should continue with their hydroxychloroquine therapy if they are either exposed to the infection or if they have documented a COVID-19 infection. So it depends, regardless of the severity of COVID-19, antimalarial therapies like hydroxychloroquine or chloroquine may be continued. But the other disease-modifying anti-rheumatic drug therapy, for example, methotrexate or sulfasalazine, leflunomide, certainly should be stopped. And similarly, immunosuppressant should be stopped. Biologics therapy should also be stopped. JAK inhibitors, which are also used to treat rheumatoid arthritis, psoriatic arthritis, should also be stopped or held. So this is what we are doing at the moment. So patients who have rheumatological condition, they are on medication, which could be simple, disease-modifying anti-rheumatic drug therapy, biologic therapy, immunosuppressive. They should be stopped. The medication which should not be stopped and they should continue taking it is the hydroxychloroquine, because hydroxychloroquine does not increase the risk of the infection. That's been proven in some studies. Steroids, we don't need to stop the steroids. Steroids should be used with whatever dose it is. However, we try our best to reduce the low possible dose. So steroids should not be, of course, abruptly stopped as well. And during the documented or presumptive COVID-19 infection, patients should continue taking steroid. Non-steroidal anti-inflammatory, they should continue taking them. However, as per the guidelines, for patient with severe respiratory symptoms, non-steroidal anti-inflammatory should be stopped. But the panel, they demonstrated low consensus with regards to stopping non-steroidal anti-inflammatory in the absence of severe symptoms. And in select circumstances, as part of the shared decision-making process, IL inhibitors may be continued, but that is very much up to the infectious disease consultant. They want to use this IL-6 inhibitor. The example of that would be a drug which we also use it in rheumatoid arthritis called Roictimra. But my advice would be all biologics therapy should be stopped. So at the same time, if they need to go on antibiotics, I would favor, if the patient have any symptoms of, let's say, upper respiratory tract infection, lower respiratory tract infection, I prefer early initiation of the antibiotics. So, for example, azithromycin or Zithromax, which you all know is also being used and given to patients who have the COVID-19 infection. It perhaps minimizes the complications of COVID-19, preventing secondary bacterial infection, pneumonia. So I would rather put them on as, if there's no contraindication for this particular antibiotic, particularly in patients who have cardiac illnesses or, arrhythmias, things like that. Azithromycin is something with a dose of 500 milligrams daily for 5 days, hopefully should be able to prevent perhaps maybe complications from the COVID-19 or secondary chest infection. But of course, the patient who have exposure to the virus, whether it is documented or presumptive COVID-19, a proper advice should be taken from the admitting infectious diseases consultant. So I thought I'll let you guys know about what I'm doing at the moment. I'm still seeing patients. I'm available for any advice or any questions you have. You can please call me at my rheumatology clinic telephone number if you have any questions, concerns about any patients of yours with rheumatologic conditions. My contact number is 056 77 21726, 056 77 21726. Email is rheumatologyclinics@gmail.com. So this short video is just to pass on the message about the recent guidelines as regards to rheumatology patients and in the context of this COVID-19 pandemic. So please feel free to contact me if you need any advice. Thank you very much. Thank you. Have a nice day. Bye-bye.